naturally.
Right on set.
Quiet on the set. Oh, well. What are the social determinants of health, and how do they affect us? Find out on Talking with Henrietta, coming up next. Hi, I'm Henrietta. Welcome to the show. Social determinants of health. What are they? According to the CDC, the Centers for Disease Control, the social determinants of health are the circumstances in which we are born, grow up, live, work, and age, as well as the systems put in place to deal with illness. These circumstances are shaped by such forces as economic, social policies, and politics. On this show, I have 3 guests who will talk about how some of these social determinants are affecting the way we live in the Bay Area and whether they are affecting all of us to the same degree. Seated on my left is Edith Kabusli, who is the manager for the Chronic Disease and Injury Prevention Unit of the San Mateo County Health System. She has worked for the county for over 20 years in the field of health education, and her areas of interest include tobacco, nutrition, physical activity, stress management, youth development, and community capacity building. Seated on my right is Pastor Marlon Bussey. Pastor Bussey served as a public high school counselor in San Mateo County for 25 years. She is the founder and president of the St. James Community Foundation, and she serves full-time as the pastor of the AME Zion Church in the city of San Mateo. Sandy Galvez is joining us by phone. Ms. Galvez is the executive director of the Bay Area Regional Health Inequities Initiative. She has worked in a variety of roles in public health and has worked as the social determinants in that area for the past 20 years. During this time, she worked with the Alameda County Public Health Department, where she developed initiatives involving social health determinants and social equity. Well, thank you so much for joining me. It's a delight to have you here with me.
Thank you.
So I talked about social health determinants and said where we were born, where we grow up, where we age. Are these social health determinants, are they basically similar throughout the United States?
So what we can tell you is that the social determinants of health are similar between different communities across the country, but they do impact communities differently. So for example, when we talk about politics, let's say as a social determinants of health, politics here in the Bay Area will play out very differently than they do in San Diego or Kansas City, New York, or Florida.
So how would that affect, let us say, the way seniors might be treated or the way some other group might be treated?
So in a community like Silicon Valley, for example, where many of the jobs that we have here are focused on the tech industry or the biotech industry, the types of workers that those types of industries are looking for are different than perhaps the types of skills that our seniors might bring. Our seniors who were born a while back and grew up and were educated and learned how to work in certain industries may or may not have the educational and the work experience to be able to be successful in a community that focuses on technology and biotechnology.
So Pastor Bussey, have you seen, well, how would you define how social determinants are affecting people in your church or areas in which you've dealt? Have you seen any impacts?
Absolutely. One of the impacts that I've just dealt with is where I had a member who needed to get some information from the doctor, and the doctor was saying, well, you can go online and get it, or you can call this number and get it. And I think that what happens is that with all the technology that is in this area, practitioners forget that seniors weren't born as digital natives. And so if they know anything about the computer, they know very little. If they have a phone, it's now a smartphone because that's all you can buy, but they don't know how to operate it. And so it leaves them really on the fringes of service unless they have someone in their family or a friend who is technically able to help them to do what they need to do. So the impact of it is, I think, pretty severe.
Interesting. Sandy, can you hear us? Sandy, are you with us?
Yes, can you hear me?
Yes, we can hear you now. You started, I mentioned in introducing you that you've been working in this area for at least 20 years, and you introduced certain initiatives. What type of social determinant initiatives were you involved in, and how did you get involved in the field at all?
Well, I entered actually the public health field first having been a community and labor organizer. So I think I came in with a perspective that so many other things in life impact your health and well-being than just whether or not you have access to health care. So I think I kind of came into the field with that perspective already. But the initiatives that I primarily started working on that were focused on targeting the social determinants early on were, I think that the determinants that we really started working on early on were around land use. The idea of how your community is designed, what you have access to, what the air quality in your community is like, whether or not you have opportunities readily available to exercise or to buy the goods and services you need, whether or not you can afford to buy or rent a place to live that is safe. All those things have a huge impact on health. And so the initiatives that related to the social determinants that we first started working on were around land use. And then, over time, we've expanded our initiatives both in Alameda County and across the Bay Area to address other things beyond land use, including economics and including educational attainment.
Okay, we'll talk about some of that a little later on. How, Edith, did this whole area, the topic area, social determinants of health, how did that come into being?
Well, what happened in the 1990s was some of the health officers and public health directors around the San Francisco Bay Area, I'm just talking about in the Bay Area in general, they got together and they started to have conversations around whether or not there were health issues that they should work on or we should work on a regional level. So they talked about things such as housing and how housing cannot be solved in one city or even in one county, that housing really is a regional issue that we need to be addressing. Transportation is another example that they felt, if there are things that need to be done around transportation, we can't try to do that just in our county or just in our city. We need to be working collaboratively across different jurisdictions here in the Bay Area. So that's how it started. Then they invited other health departments around the Bay Area and came together and started to have a discussion around what the priority issues are that we should be addressing as public health departments if we really wanted to impact health positively. And one of the things that they noticed in taking a look at the data is that when we put a lot of resources on dealing with one health condition at a time, that we may or may not have an impact on that health condition, but that health condition is impacted by so many other factors, the social determinants of health, that if we found a way to be able to address the social determinants of health, there would be so many health conditions that we would be addressing at the same time. So by addressing things like housing, you would be addressing things like tuberculosis, other communicable diseases, and you'd be also addressing things like physical inactivity, eating healthy, and things like that by working more upstream instead of dealing with one health condition at a time.
That's fascinating. Pastor Bussey, how did you get involved in the whole area of social determinants? of health?
I got involved in a most interesting way. I was approached by a friend of mine, Gloria Rhodes Brown, who said to me, "Did you know that there's math displacement going on?" And I said, yes, I did, because as a counselor for 25 years, I had worked to help parents to override teacher recommendations because their children, by their records, were misplaced. And so I had a town hall meeting in June of 2013, and that was all that I thought it was going to be, as a town hall meeting to inform the neighborhood. The church was packed, and so many people said, that happened to me, or they knew someone that it had happened to.
When you talk about misplacement, math misplacement, what does that really mean?
What that means is that a child in middle school has received the grade of an A, earned the grade of an A or a B in Algebra 1, and rather than them going to high school and being allowed to take the next course, which is geometry, certain children were being forced to retake Algebra 1. And when you do that, the 12, 13-year-old brain says, I don't want to do this again, I already did it. And so what they do is they don't do the work. They just kind of give up. They're like, I don't want to do this,
You said certain children, so should I simply assume you're talking about children of color?
I am talking about children of color because disproportionately it is children of color who have been required to retake a math class that they've already been successful in.
So we're talking social determinants of health. How would you see that, Edith? Or even Sandy, if you're following along, how would you place that as a social determinant of health? Sandy, would you like to answer that? I did ask Edith, but can you hear us?
Yes, you're talking about educational outcomes as a social determinant?
Yes, yes.
Well, so education is a key determinant. The connection between education, life opportunities, and good health is absolutely clear from the research. It's actually one of the strongest predictors of income. And obviously income opens up employment opportunities, higher quality work, safer working conditions. Folks with less education are more likely to work in low-skilled, low-wage jobs that are significantly more dangerous, more stressful, and as a result, they usually they live sicker and shorter lives. And so, obviously, education provides the skills and knowledge for employment. But beyond that, people with higher education are also able to develop networks with other people through employment that have higher paid jobs, and those provide future opportunities. They also tend to be able to develop stronger interpersonal skills that can lead to supportive relationships and things like that. So education is a key determinant of health.
So are we talking about the ideal in terms of disparities and getting rid of the disparities in terms of education? Is this an ideal circumstance?
I don't think so. I think it's something that we can and we must make a reality. Because the other thing that happens to students when you force them to repeat something that they've already had success in, it becomes a mental health issue. They become depressed as a part of feeling like they're not good enough, they haven't proved themselves enough. And so when depression begins to enter in, they begin to act out in class, and then they become a discipline problem, and it just snowballs into some really sad places for these children. So I think that we have a responsibility as a society to force school districts to do the right thing by children and allow them to move from one course to another, as they have proven that they're capable to do.
Now, that's just one instance of maybe a social inequity or a disparity that can snowball throughout a person's life and
Yes.
might be snowballing for a group of students. Is this something that's isolated?
No, it isn't. Actually, the research that Pastor Bussey is referring to happened between San Mateo in Santa Clara counties, taking a look at all the schools and the transition between 8th grade and 9th grade across all those schools. If this is isolated, it may happen to one child in one school going to a specific high school. It shouldn't be happening to child after child after child. And then when you see the pattern where this disparity is happening to very specific groups of people, whether it's in Santa Clara County or in San Mateo County, something else is impacting those decisions that teachers or school districts make that hold back those children from taking the math classes that they should be taking. And math is a very important subject because it's one of the few subjects where whether you're a college in Connecticut or you're a college in San Diego, you know what the pattern should be. Children should be taking Algebra 1, Geometry, Algebra 2, and then they may take Pre-Calculus, and then Calculus 1 and Calculus 2. So if you're not able to take, if you take Algebra and then you have to retake it again, you lose a year in mathematics. And by the time you get to be a high school, you have one less opportunity to be able to take the advanced level classes that you might have needed to be able to be competitive for the universities you might have wanted to enter.
Well, you talked about county health departments collaborating. So I'm going to ask you, Sandy, since you've worked in the area of social equity, how do you tackle an issue like that? It seems to me that might very well boil down to racism or prejudice. So how do you deal with an issue like that?
Well, I think one of the things that we're trying to do as health departments is to educate the greater public about the connections between these different social determinants and health outcomes. I think that when people hear that, you know, across the board, we see sometimes a 10, 15-year difference in life expectancy for children born in one community versus another. And I'm talking in the same city, but it's like whether you're in a poor neighborhood of color or in a wealthy white neighborhood, the life expectancy for children is completely different. And that's just fundamentally not fair, and I think that speaks to pretty much everybody, that sense of that any child that's born should have the same opportunity to lead a long, healthy life and not automatically be able to count that they're going to live 10, 15 years less just because of where the conditions under which they're born and then how that's going to snowball throughout their life. So I think that's one of the things that we try to do is really just try to educate the public and policymakers about the connections between these different determinants and the decisions that get made in those determinants, and then how that ends up turning into really different health outcomes down the road. We're also looking at, and I think that, you know, by kind of highlighting the patterns that Edith was talking about and really making that data much more transparent, you know, we, at the end of the day, you know, the policymakers have to look at why are their decisions impacting certain communities a certain way, and what are some of the underlying assumptions that they're bringing into the decision making that they're doing. So yes, it is very hard, but I don't think it's insurmountable.
Sure. So since it's not insurmountable, Edith, can you tell me, is there an example that can be given where the data has changed a policy?
Absolutely. I think that one of, we have many examples where data has changed a policy. Probably a very recent example within the work that we do in San Mateo County is in the area of tobacco. One of the data pieces that we're taking a look at is that asthma rates seem to be higher in multi-unit housing facilities. Our community started to become interested in what we can do to protect the health of children who live in apartments, in condominiums, and townhomes. And there became more interest in seeing if we could make those facilities be smoke-free. So there is now a movement across the state, but specifically in San Mateo County, to get our policymakers to consider whether we should make apartments and townhomes and condominiums to go smoke-free. And the data was used to show the support and the impact of those housing conditions on the health of people who live in them. So Stanford University came to many of our community meetings to talk to our policymakers around when you have two apartments next to each other and one person is smoking in one apartment, how much time it takes for the smoke to travel to the next apartment, and how that's going to impact the health of whoever lives in that apartment. Whether they smoke or not, they're breathing in secondhand smoke, and that could impact their health. And if there are children with asthma in that apartment, how that could negatively impact their health. And a child with asthma who gets sick with asthma might not be able to attend school, thereby impacting their own educational attainment possibilities. So we use that data, a lot of research data. We survey the community to find out what their perspectives are around being exposed to secondhand smoke if they live in apartments. And we brought all that data to policymakers to show them that there actually is community support for turning apartments and condos and townhomes smoke-free. And so little by little, our cities, one at a time, are taking a look at that and considering whether or not that makes sense for their community.
That's fascinating. Would you take a position, or have you taken a position? Have you seen any data? Of course, you've worked in the area of math displacement, but have you seen any other data that you think merits action?
Well, you know, the Silicon Valley Community Foundation has a plethora of data on this particular subject. They have done all of the work, and I'm really happy to say, I mean, we started the St. James Community Foundation as a response to try to help level the playing field for students of color. And we've been quite successful with that, but next Wednesday I'll be in Sacramento testifying at a hearing for Senate Bill, I believe it's 359, it's the Mathematics Placement Act of 2015. And I'm really excited about that because the data is what has pushed this issue to the forefront and allowed the folks in Sacramento to realize that there really is a problem, that it's very, very widespread, and that this treatment of children needs to be stopped through legislation. And so I'm thrilled that, that we're going to be testifying next week, and hopefully we'll convince the folks in Sacramento to pass this legislation.
Before
I
get to Sandy, what type of law can stop math displacement? Since whether to promote a child or not, is that up to the individual teacher?
It is not. It is. Teachers do have the right to issue grades, but they must issue grades based on what the child has performed in their class. So really, it's not about teachers giving grades, it's about students earning grades. And if a student earns a passing grade, then that student will, if this bill passes, will be automatically placed in the next course. And that's all we're asking for, because as Edith said earlier, when a student is forced to repeat a course, they lose a year. Having a student repeat the same course for the third time absolutely destroys their confidence.
Third time?
Well, because if they've taken it in algebra, if they've taken algebra in 8th grade and passed it, and then you say, no, you have to show us again, and they take it in 9th grade and they fail it because they're so discouraged, then the system can say, you failed it. Now you've got to repeat it again. And so you can have a student take the same course 3 times before they get to move to the next course. And by that 3rd time, their chances of 4-year college are out the window. They're completely gone, because you have to get through at least Algebra 2 in order to qualify minimally for 4-year college. So then they're relegated to the 2-year college system. There's nothing wrong. I love the community college system, but I think it should be a choice, not a student's only option.
So Sandy, what Pastor Bussey seems to be dealing with are issues that involve racism. So I'm wondering, are there other issues, since you've worked in the area of social equity, that brings up that this type of concern? Did you hear me, Sandy?
I did. I think that the fact is that we have a country that was based on racist practices. And it's kind of almost like in the air we breathe, I believe. And it's permeated, I think, decision-making throughout our country's history in many ways. we really see that, you know, the creation of concentrated neighborhoods of concentrated poverty that are as just by accident, some would say, also happen to be neighborhoods that are concentrated people of color is no accident, and that ends up impacting the opportunities that people have that live in neighborhoods of concentrated poverty. I think laws like Proposition 13 that really impacted the funding of public education. I think some of the underlying values behind the passing of and the maintenance of Prop 13 is around racism as well. So yes, I do believe that structural racism permeates decision making in many areas.
Well,
even
that's
if
not
it's not blatant or even obvious to people that they do have. They are continuing to help permeate some of the past practices.
So while you're talking about that, how do you deal with that? Do you first have to change public attitudes? Do you aim towards changing policies? Do you aim towards changing conditions? How do you attack a situation like that? That seems to be systemic.
Well, I think you probably have to do all three. But I think oftentimes we've seen that the best way, certainly with the civil rights process, the best way to combat a lot of the racism was through policy change that mandated certain things had to happen a certain way, and public opinion more or less eventually caught up, but it didn't start with public opinion change first. And so I think it's, obviously you can't change policy if you don't change the opinions at least of a significant enough sector. But I think you have to focus on policy change if you're going to make systems change.
Sure, thanks. So Edith, are there any priorities? You talk about the county health departments collaborating. Mm-hmm. Are there certain issues that rise to the top of the list?
I think there are many issues that are important for us to address. But in the area of education, there is a movement called the Big Lift that is in San Mateo County, where we are taking a look at how we can improve the educational outcomes for our children. And it's focused on making sure that our children, when they are young, have adequate and appropriate child care. It is working towards kindergarten readiness. It's going to work towards third grade literacy. Pastor Bussey's efforts are contributing to that transition between 8th grade and 9th grade, and we are looking to improve our high school graduation rates throughout San Mateo County. So regardless of what program we might be running within our health department, or regardless what programs our community-based partners might be working on, if we have an opportunity to touch the lives of families with young children, families whose children are getting ready to transition to kindergarten, elementary school-age children, adolescents, and preparing high school students for what happens beyond high school graduation. Wherever we are able to touch people's lives and families' lives, that's where we choose to contribute as a health department. So educational attainment is one of the issues that we are encouraging all of the Bar-High member health departments to be taking a look at. Within our health department, we also take a look at our health and quality of life data that shows what is killing our community at the highest rates. And we take a look at those health conditions and what contributes to those health conditions. So
let's talk about an example. What is killing our communities at the highest rate?
Heart disease and cancer are 1 and 2. Occasionally they flip, but 1 and 2, heart disease and cancer. And when we take a look at what causes heart disease.
Well, before you do that, and I would like to go there, but is this something that cuts across all races, all income levels, heart disease and cancer?
Yes. Across the country, heart disease and cancer are the top 2 killers of our people. In California, heart disease and cancer are the top 2 killers. In San Mateo County, heart disease and cancer. So it's pervasive across all communities. It may be that when you take a look at, let's say, cancer, when you take a look at the Southeast Asian community, it might be different than it might be for the African American community. But in general, as a whole, cancers are one of the top 2 killers for San Mateo County. And so when we take a look at what causes cancer and what causes heart disease, and we take a look at what the risk behaviors might be that people are participating in that might put them at risk for developing cancer or heart disease, we find things like tobacco use. We find things like physical inactivity or having a sedentary lifestyle. We take a look at things like unhealthy eating habits. And unhealthy eating habits and being sedentary also contribute to obesity and diabetes, so more than just heart disease. And the same thing with cancer. When we take a look at tobacco use, for example, that causes heart disease, and it causes also lung cancer, for example. So there are risk behaviors that impact more than one health condition. But we go further than that. We go even further upstream, and we think about what contributes to people's tobacco use. How are tobacco products being marketed to our communities? Are they targeting specific segments of our community? And they are. Research is showing that they are. And we take a look at if they are targeting specific segments of our community, what can be done at the policy level to make sure that we counteract or we mitigate the harm that they do to those communities.
You said that they are affecting various communities in a different way, or various segments. So which segments of the community are affected the most in terms of tobacco?
So when we think back to the days when tobacco ads showed up in all of our magazines and all of our television sets, they targeted women, they targeted teenagers, young people, they targeted communities of color. When you would open a magazine and you would see people who looked like you doing fun, cool things and smoking at the same time, you feel like that's what you want to do in order to fit in with that community. So we knew that they were targeting, even in how they flavor tobacco products. So at the federal level, we've done away with many flavors of tobacco products, but the one tobacco product flavor that still remains is menthol. Menthol is a flavor that was developed specifically to target the African American community. So while we might have done away with many flavors in tobacco products, that somehow has been exempted. And menthol continues to be a flavor in tobacco products. That's very interesting. And there are very many reasons why that's the case. But as we think about what's happening, especially with our young people recently, the whole issue of electronic cigarettes comes up.
Yes.
And electronic cigarettes are unregulated. Nobody is taking a look to see what's in them. And they have flavors like pina colada and chocolate and strawberry, things that are very appealing to young people. And they're not regulated, so they're just out there marketing. They're even on TV with ads, with celebrities using them and promoting them. And we find this in public health very alarming, because we see it as the tobacco industry's way of getting people hooked on nicotine, so that at some point they're going to take on the tobacco habit.
You know, too, I just had a conversation with a young person about e-cigarettes, and she happens to work in an office where the people there are smoking e-cigarettes, and she said that the smoke from e-cigarettes is worse than if they were smoking actual cigarettes. And it's very, very irritating to her lungs. So it's really interesting that you would say that, because it feels like a setup for just another generation to get addicted.
So and that was the question I was going to ask you, or that leads into the question. It seems it's an uphill battle. You can have the data, you can break it down in terms of who's affected most, how are they affected in terms of segments of the population. But then you still have to deal with certain interest groups and certain segments that have the money and the vested interests. Are we getting better in terms of dealing with situations like this, or do some issues seem to be like 3 steps forward and 2 steps back?
I think every process of change is 3 steps forward and 2 steps back. But I think that the thing we have to do is keep making forward progress, keep moving in the right direction. You know, will this bill, if it passes, be a panacea and all the children's problems will be over. No, because you still have a human factor. And I think that Sandy said it. Anytime you have a human interaction or a human interface, you're going to have subjectivity more so than objectivity. And so we still have to be gatekeepers and make sure that people are being treated appropriately for whatever. Whether it's cigarettes, we need to say no to e-cigarettes. We need to say no to cigarettes, period. It amazes me that anybody under 40 would try any sort of cigarette. It amazes me because of all the data that's out there. Yet, what Edith said, the urge to be cool, having peers that smoke, all of that plays into it. So we still have to get out there and beat the drum for the issues that we know need attention.
Sandy, Pastor Bussey said that we have to still work forward to go in the right direction. What's the right direction for you? And, well, let me leave it at that. I think each of us has a different definition or a different concept of what's the right direction. So what's the right direction for you, and how does one determine it, Sandy?
Well, the right direction for me is moving towards a society where there really is much more equity of opportunity for every child that's born, regardless of their background. Equity and opportunity regarding where they get to live, what they get to breathe, whether or not they have safe places to play nearby, what educational opportunities they're going to have, what opportunities for well-paying jobs they're going to have down the road, what their social environment, what the media that they're being exposed to, that they're all going to have equal opportunities. And so for me, that's the right direction.
Why is there so much controversy or so many differences of opinion? For you, that's the obvious direction. But what's the pushback?
I think the pushback is just like we said. There's vested interest in keeping the status quo. Exactly. And I think, this whole issue of the shooting of black men all over the country, I think is part of the pushback of the status quo being challenged. Like I said, I think we're a country that was founded on certain practices, and those practices were eliminated, but the sentiments didn't necessarily leave our policy making and the way we established our communities. And that still continues to permeate some of our thinking.
Okay, thanks, Sandy.
Create a society where some people have privilege and others don't, and then that privilege is passed on to the next generation and the next generation and so forth, and the folks that don't have the privilege are passed on the lack of privilege to the next generation and so on and so forth. And in order for there to be more equality of opportunity, there needs to be a little bit more sharing of who has privilege and who doesn't.
Well, there are people who would say you're never going to level the playing field. And the idea of leveling the playing field is maybe a classic liberal notion. So I can imagine what you might say, Sandy, so Edith.
Well, I think that what Sandy is saying is true, that when a child is born, they didn't get to pick what neighborhood they were going to be born in. They didn't get to pick what house they were going to live in, and they don't get to pick what school they're going to end up in. But depending on where they are born and what house they live in will determine what public school they might go to. And just today we were taking a look at data related to the city of San Mateo. 2 different schools in 2 communities that are 3 miles apart. The values of the home in one community predicts the quality of education that a child will get in that elementary school, and will predict how appealing that neighborhood will be for people who want to buy homes in that neighborhood. It also predicts who's likely to be in that neighborhood. And all this you can predict about a child who just got born, who hasn't even learned how to speak or hasn't even learned how to stand up and walk yet. And yet people are already making predictions on how well they're going to do when they get to, whether they're going to be reading in 3rd grade, whether they're going to graduate high school, and whether or not they're going to end up in prison. Those are things that can be predicted, and as Sandy also mentioned earlier, depending on where you live, could determine how many less years you get to live as you grow up. And that's just not fair, that a child who just got born today, somebody could predict how long they're going to live.
Yes, but you know what? There would be people who would say life isn't fair. It's just the way it is, and not everybody's meant to live for the same amount of time.
Well, the unfortunate thing is when we take a look at the data, and we take a look at two neighborhoods in the same city, and we find that a group of people live so many years less than a group of people in another part of the city. And when you take a look at this data for one city, let's say we took a look at it in Oakland, if we take a look at it in San Mateo, or we take a look at it in East Palo Alto, we should ask ourselves, is it fair that just because a child was born in a specific neighborhood, they should have 10 years less of life? Should we not have a society where every child grows up and has the same opportunities to go to good quality schools, be able to do as well as the work that they put into their education, be able to advance in math the way that they deserve, and have the same opportunity to be able to go to, whether they want to go to a 2-year college or a 4-year university, have the opportunity to make those decisions and make those choices for themselves that will determine how healthy and how long they're going to live.
So is this a proper, what is it, responsibility of government?
It is,
There would be
absolutely.
those who would say, you know, this is a nanny state. Is it that idea of nanny? And you can't, people have individual choices. People have individual responsibilities. And people have a right to smoke if they want to smoke. They have a right to exercise or not exercise, or to drink or not drink. It's individual choice.
It is, but they also need to have the same opportunity. I think that when you take someone like Tiger Woods, a young African-American man who rose to the heights in the world of golf, why him and not many others? It was because of opportunity. His father made sure that he had the opportunity to learn the game, to learn it early. I think that that's how we begin to level the playing field. If people in north central San Mateo had a park that had a par course, I've looked for one, I can't find it. I have driven around the neighborhood. King Center is right on the corner from us, and I just told the city officials about 4 weeks ago, why isn't there a par course somewhere? If families want to walk together, if they want to exercise, there's nowhere to do that in that neighborhood. And that disturbs me, because what that means is that that child that's born and lives in that house on Delaware Street or Idaho Street has less opportunity to exercise because there's nowhere to do that.
So people would say, isn't it up maybe to that child's parents to talk to the city officials in that particular city and have city officials delegate the space or somehow make the space?
Absolutely, and they could do that if they weren't working 2 jobs to pay that ridiculously high rent. You see, you know, when parents don't have to work, or when parents have jobs that allow them to participate more, those children are automatically at an advantage because they have somebody to advocate for them. When a parent is working 2 or 3 jobs just to put food on the table, just to make sure their children get medical care, and just to make sure they keep a roof over their head, they don't have the extra time. They can't go to the school board meeting.
And whose fault is that? Sandy, have you been following this conversation?
I have.
Any comments?
Whose fault is it that they have to work 2 jobs?
Yes.
Well, I think it's exactly what I was talking about. I think we just have a cycle that keeps repeating itself. Most people that are in poverty had a family, their generation before them was also in poverty, and the generation before them was also in poverty. If we don't break that cycle and give people the opportunity to be able to have a better life and pass on a better life to the next generation, we don't break the cycle. And yes, people have individual choices, but within the system that they're part of. And if the system is already stacked against you, regardless of how hard you work or how much effort you do, you're only going to be able to get as ahead as the system allows you.
So there are those who would say that there are limited resources, and if you make certain changes, you're taking away from those who have to give to those who don't have. And is that fair? So how do you then spread out limited resources and give equal opportunity without taking away from somebody?
Actually, in the field of education, the data is showing that when you, let's say in one school that's a high-performing school, when you bring in children who may come from schools that are less high-performing, you bring in children who are struggling into a school like that, you do not decrease the scores of the children who are doing well. You do increase the scores of the children who are struggling because they are part of the system that is supportive. They're going to be able to participate in classrooms where teachers were more adequately prepared to teach, and they're going to have resources available to them that help them do better. So the students who are struggling do better. The students who already were doing better are not doing
So
worse
is that
than
widespread?
before.
Because I would think if you bring in students who are disadvantaged into more affluent schools, they might fall further behind because it takes certain skills that they may not have acquired to compete with those who have every advantage.
Of course, you'd have to bring them into a school like that and make sure that they have the support that they need, but the research has been showing that across, it isn't like isolated to one school, that across many schools, when these have been done, when you bring in these students into these high-performing schools, they do improve their test scores, and the students who already were doing well do not suffer from having these children in their schools.
And their test scores improve because those schools also have better support systems, better academic support systems. So higher performing schools have better academic support. If a student needs to have a math class and a math support class, they get that. If they need a reading class and a reading support class, they get that. So there's extra help built into a student's day to allow them to excel.
So it seems the objective then would be to concentrate on those underperforming schools, to bring up their standards and increase their support systems so that you don't have to have a child who's underperforming have as their only option going to a higher performing school.
Well, I think many of our school districts are taking a look at that specific issue and trying to come up with ways to be able to resolve some of those problems, because the data is pretty consistent that in specific neighborhoods and communities, schools have lower performing students. What do we do within those schools to improve the academic outcomes for those students? So studies have been conducted in specific schools and among school districts to take a look at maybe it is changing the theme of the school, maybe it is focusing additional resources with specific segments of the community. So the state of California has a new funding formula called the LCAP, where they're taking a look at very specific segments of the student population where data is showing that they're not doing as well. So second language learners, foster children, and children who come from second language families are children where now state law is requiring schools to concentrate some resources in making sure that these children have the supports they need to be able to do well.
Sandy, can you talk about some initiatives that your organization might be working on now in the area of social determinants of health?
Well, one of our initiatives that we're doing across the region was one that Edith spoke to a little bit, which is focused on education and trying to improve educational outcomes for the communities that have the worst health outcomes. So we're working, health departments across the region are coming together, identifying strategies where they can partner better with schools, as well as look at how to integrate strategies specifically focused on educational improvement into the programs that health departments are already doing. Health departments do a lot of home visits with young mothers or mothers with young children. We have a lot of programs, and services where folks come in to get different education, health education classes and things like that. So we're trying to bring educational related materials and discussions into the different kinds of programming we already do. So that's one of the initiatives that we're doing that's focused on education. We're also really involved in the development of the Bay Area's long-range land use and transportation plan, which is called Plan Bay Area. We were deeply involved in the development of the last plan, which was the first plan, and that was approved in 2014, and then we're going to be involved again in the update of that plan. It's a 30-year land use and transportation plan, and we really want to try to inform decision makers about how the different decisions that they make along the way will impact equitable health outcomes down the road.
So can you give us an example of something that you're proposing in the area of land use that would have an effect on health outcomes down the road?
I'm sorry, I didn't hear the beginning of the question.
Can you give us an example of a land use proposal?
One of the things that we're advocating for is to really bring up the number of affordable housing units across the Bay Area. That having unstable and unsafe housing and folks not feeling that they can afford to live in a place where they have access to the things they need is a really big driver for health. And so bringing more opportunities for people to have affordable housing to cities all across the Bay Area is definitely one of the things that we're working towards in that plan, as well as developing anti-displacement measures across cities, so that as we make improvements to the communities, that doesn't force people that have been long-term residents out from those communities. So those are two of the things that we're striving for in that plan.
All right, thank you. Edith, in terms of priorities right now that the San Mateo Health Department might be considering or working on, some other projects, as if those that we've talked about aren't enough.
I think that we have many priorities that we're working on as a health department. We are currently in the process of having conversations and forums in the community to determine what our community members feel would be needed to make our community healthy. So there are conversations happening throughout San Mateo County around that. So going to where folks are, so they're happening in different areas of the county, and asking them, in your world, in your vision, what would you like to see happen in your community? And having the community actually inform us as government workers what priority issues they want to address. And the things that are coming out are things like housing. They want jobs that pay living wage. They want to have open space so that they can be physically active with their families in the community. So things that we are talking about between our organizations on the regional level, when we actually talk to residents in the community, those are things that are important to them. Housing is such a huge issue for so many members of our community, to have families be renting a garage, a one-car garage, and paying $1,000 a month for something like that, and to not have the rest of the home or to have the backyard, is something that is becoming a problem. And especially in this community where we have a lot of technology and biotechnology companies and workers who are able to make a higher income and are able to afford and compete for those rental houses, or be able to buy those homes at higher prices than other folks in this community. It's such an issue, and it's such a serious issue, that we need to be taking a close look at it to see how we could address some of those issues for our community. Because unless people are able to live where they work, where they go to school, and where they spend most of their time, we're going to continue to have people who are going to be disadvantaged when it comes to health conditions.
It's true. I just had a parent, one of my math tutoring parents, that I was talking to, and her issue was that her child had asthma. The place that they were renting had mold. And she was told by her landlord when she asked if he could get the mold remediated that if she didn't want to live there, then she could just move. And that was my reaction. Exactly your reaction right now. I was appalled that anyone would be that heartless and that uncaring about the health of a child. So those issues are real. They're real.
Yes, they are real, and I think the health department has some rules and regulations, doesn't it, that a landlord has to have a habitable dwelling.
We do. I think that there are many factors that contribute to habitable dwellings. So one of the things that we take a look at, for example, is in some areas of our community, there would be a home. Let's say it's a 3-bedroom home. It's likely that in one bedroom there might be one family, 2 parents, 2 children, and that every bedroom might be occupied by a different family, and the garage might be occupied by a different family. Now we have what we probably as a society would think is an unhealthy living condition. If you rent in that home and you want the mold to be addressed in that home, and you were the primary renter in that home and you let other families live in the home because that's how you needed to deal with the fact that you couldn't afford the rent, now you have what people might call an illegal living condition.
Yes.
And if you complain, you might be told what this parent was told, that you can move out anytime you want, or you might actually get evicted because now they decided that they don't want you there
but there are certain
anymore.
protections, and so I think she will have to look into what protections there are and what laws there are. Sandy, do you have any final thoughts, something that you haven't shared that you would like to share with us?
No, I thank you for the opportunity for being on the show and being able to be part of this conversation.
Well, I thank you so much for joining us. It's been a delight to have you. Something that you haven't shared, Pastor Bussey, that you'd like to share?
Only that I really hope that that the efforts that we're making through the math tutorial program will have the impact that we expect them to have, and we hope that one day we can work ourselves out of business. We hope that we'll have to find a new issue, a new issue of social justice to deal with. But I think for the foreseeable future, this will be
Well,
where
if it
we are.
is true that we take 3 steps forward and 2 back, I think there'll always be some issues that we'll need to work with. Some things that we haven't shared, Edith, that might be important to share?
I think something that Pastor Bussey forgot to mention, something very important that her organization is working on, is parent engagement. I think it's very important as we move forward that we mobilize our community, we educate our community, and we empower our community. If parents knew what their rights were, like the rental rights, if they knew what their rights were as parents within the school system, and they knew how to exercise those rights, we're going to have more of an empowered community who can make choices for their families. And I think we're going to be becoming healthier, and that's something that Pastor Bussey is working on currently.
Yes.
Well, I'd like to thank the 3 of you, Sandy, Pastor Bussey, Edith, for joining us to tell us where we are, some of the priorities that health departments are working on, and some of the things we need to do. I'd like to thank our audience for joining us. Until next time.